Welcome to Genetic Diseases. Today we're talking about ASD, or Autism Spectrum Disorder.
Autism is a mental disease that causes difficulty in speaking, using language, and forming relationships with people. We're here with Spencer Ward, a scientist from Camerado who has recently been studying autism. We will now interview him about what he knows. So Spencer, when did scientists first become aware of ASD?
Scientists first became aware of autism in 1944. Before that, autism was being known as a disease.
And what are some symptoms of autism?
Some symptoms of autism include no babbling or pointing by 16 months of age, no two-word phrases by age 2, no smiling, no response to their name, and excessive lining up of objects.
And how was autism treated in the past?
Autism wasn't treated in the past until they developed therapy. One reason for that was because it wasn't known as a large disease.
And what you got here?
Oh, right here, I have a chart that shows the chances of getting autism from 1975 to 2009. In 1975, it was a 1 in 5,000% chance it could get autism. But then in 1985, it went from 1 in 2,500. In 1995, it went 1 in 500. 2001, 1 in 250. 2004, 1 in 166. 2007, 1 in 150, and 2009, 1 in 110.
Wow, that's amazing. Thank you for being on the show.
Now for some more autism statistics with Spencer Ward. Go ahead, Professor.
Alright, so lots of people have been asking, what causes autism? Well, there really is no known single cause for autism, but it is generally accepted that autism is caused by abnormalities in the human brain structure and function. One of the treatments for ASD is ABA, Applied Behavior Analysis. Applied Behavior Analysis is a form of therapy that many autistic children choose to participate in. In the chart over here, I have 50 people. It is a 0.53% chance that a girl could get autism, but it is a 2.83% chance that a boy could get autism. In the U.S., 1 in 88 children from ages 3 to 17 years old can get autism, and 40% of those cannot talk at all. More children will be diagnosed with autism this year than AIDS, diabetes, and cancer combined. Since 2001, the growth rate of individuals diagnosed with autism in California schools has risen 18% annually. Autism receives less than 5% of the research funding of many less prevalent childhood diseases. The average annual growth rate in Santa Clara is 17%, the Bay Area is 16%, and all other places in California is 18%.
Thank you for talking about what you know, Spencer.
We are going to interview a woman and her son about the topic autism, but respectfully, she was too emotional to talk about the topic in person. So she asked for us to send her a copy of the questions through email, and she responded. The first question was, what were medicines and treatments for the disease that could help? Her response was, my child received early intervention services since he was 1.5 years old, though he doesn't take any medications, as he was not thriving and missing important developmental milestones. He received occupational, physical, social, sensory, and speech therapies for almost a year before being diagnosed with ASD. As parents, we also received training on how to play and interact with our child in ways that promote his social interaction skills, manage his problem behaviors, and teach him daily living skills and communication. It is a constant adaptation as he grows. We have treated my child's ASD with 3 out of 4 types mentioned, and we have accomplished lots of progress. Nevertheless, it's important to say that as a parent, you have to do your own research. We have tremendous dedication when attempting any of the treatment approaches. It is very important also to say that as your child's best advocate, you have to request to modify the treatment approach to your child's and family needs. The second question was, What are symptoms of the disorder? She said, "My son appeared to be normal until he was 1 year old. Then we started noticing he was having no eye contact, no kisses, no responding to his name, no pointing. His vocabulary was limited and repetitive. He was very focused on the wheels of toys. He will use repetitive sounds as well as loved spinning. As he has grown older, we have more of the symptoms listed above. In my opinion, most kids will improve, and a big playing factor will be the access to good quality treatments and appropriate services to support people with autism at different life stages unless there is brain or either organ damage due to comorbid medical conditions." Our fourth question was, can life be shortened due to the illness? Her answer, autism is a bioneurological developmental disability that generally appears before the age of 3. Autism impacts the normal development of the brain in the areas of social interaction, communication skills, and cognitive function. Autism itself does not affect life expectancy. However, research has shown that mortality risk among individuals with autism is twice as high as the general population, in large part due to drowning and other accidents, as people with autism tend to demonstrate little safety or danger awareness. My son presents little sense of safety and danger awareness, especially when relating to crossing the street and talking to strangers. Those were her answers to our questions, and we thank her for talking about this subject.
I hope you enjoyed this presentation and you learned a lot about autism.
Thank you so much for watching, and we hope that you'll respect all the people that have autism.